Battling COVID-19, it requires close collaboration between the state and local government. And throughout our fight against COVID-19, the state has worked closely with local governments to slow the spread, fill the gaps, and let locals lead in their communities. Together, we've made important progress in helping to stop the spread of the virus by building a contact tracing army and expanding and speeding up testing. Today, I wanted to update you on some of those efforts. Notably, the efforts to increase testing, which now are averaging over 125,000 daily tests. Over this weekend, we were averaging a little north of 150,000 tests, 169,000 on Saturday, about 144,000 tests just yesterday. We're getting those test results back within 24 to 48 hours. In fact, 90+% of all the tests that are being conducted are getting back within that time frame. And as a consequence of that timeliness to test results, it enables our local contact tracers to get to work immediately. I wanted to update you on the total number of trained staff, the total number of contact tracers now that we have assembled here in the state of California. Just shy of 11,000 now trained staff, 10,892, 1,800 plus bilingual staff. And I'm going to ask Dr. Ghaly to come up here in just a second and talk about some of the remote support that is also part of our contact tracing efforts. A lot of work has been put into this place, not as much attention perhaps is deserved, and that's why we wanted to highlight some of our contact tracing status here today. And again, no one better to do that than Dr. Ghaly.
Thank you, Governor. And yes, it's good to be with you to talk about our developments on contact tracing and really where the governor started that testing piece that starts us with case identification, finding out who's positive, and then we go into the disease investigation part of the endeavor and identifying close contacts of people who are positive so we can then provide the support and reminders to isolate appropriately so we can actually cut down transmission from each case. That isn't a new set of strategies for COVID. We've been doing this in public health for decades to control other diseases across the globe. And here the challenge is just doing it at the scale where we have thousands of positive test results coming a day to make sure those thousands stay as low as possible. I talked to you many weeks ago about the need to get our case rate down and our infrastructure of contact tracing and disease investigation up. We've done that with these 10,000 plus trained staff, many bilingual staff, not just in Spanish, but in Cantonese and Mandarin, Hmong language, many different languages across the state. And then the ability to use something we've all become familiar with in COVID, which is remote interactions. Many of you do Zoom meetings or Zoom encounters and meet friends remotely now via your iPhone and other phones. We also have employed those same technologies, providing disease investigation support with epidemiologists that might be in one county supporting another county hundreds of miles away because they can do that remotely. Also adding a virtual agent function to our CalConnect. That's the program that the governor really pushed us to create statewide to organize all of the case information and the contact tracing work. Now there is a function that allows us to do an initial survey of individuals who tested positive or who may have been exposed so that health departments can begin to prioritize those with the most concerning exposures. So all of that together with the staff are really building up this infrastructure across the state so we can continue to box in the virus as much as we can and make sure that a single case doesn't turn into 20 or 30 cases from that single one. So we did this twice. We did a survey many months ago of our local health jurisdictions to find out how successful their existing infrastructure was to contact trace all the cases that were discovered as well as their contacts. Back then, we were certainly lower than we are now. And today, we are finding that 95% of our local health departments are able to contact all of the new cases that they receive results for on that same day. So the addition of quick testing with quick turnaround time, that 24 to 48 hours, plus information in the hands of local health jurisdictions and the staffing sufficient to reach all of those positives, gives us a better chance of making sure somebody who is positive doesn't transmit to others. Similarly, we have 97% of our local health departments who are able to contact all of the contacts that we learn about on that same day. These two things together allow us to have a better chance of keeping COVID in check. Part of this really does start with the support of the state with our local partners. I want to remind you that contact tracing and disease investigation is a tried and true public health tool. The local health jurisdictions across the state have been doing this for a long time. They've beefed up their staff, increased their staff and their tools along with the state's support to do this. We are now turning a significant part of our focus at helping our local partners with school-based modules in CalConnect, making sure that we're able to track cases in schools either among staff or among students, and providing tools to increase our ability to address outbreaks and investigate them. I want to remind you that we did pursue a public-private partnership with Kaiser, many other philanthropic partners, to work with our local entities to deploy local teams, people in community-based organizations that really do know the communities well, that live and work within the communities to provide a closer touch to those who might need that contact tracing and isolation support. And we also put out and described, when we described our equity metric, the need for counties to use state funds that were provided to the counties to do testing, contact tracing, and isolation, to make sure those dollars are invested in those communities where we've seen a disproportionate impact on COVID. Those dollars are there in part to support the last piece of this three-legged stool, that part that focuses on isolation and supporting individuals who learn that they're positive or may have been exposed to either quarantine or isolate, whichever is appropriate, and to make sure that they do it in a supported way. We know so many people fear not being able to return to work, not being able to support their families. There are many tools that the state, along with our local partners, along with our philanthropic partners, have put into place in order to support those isolations to not just happen, but to happen in the most complete way so we box in the virus and reduce transmission. So with that, I want to turn it back over to the governor. Thank you.
Thank you, Dr. Ghaly. And so the key is the issue of isolating individuals that have come into contact or have the transmission of the disease made positive, meaning we want to make sure that the testing leads to something. And in order to box this virus, in order to mitigate the spread of this virus, quarantine and isolation become essential. And I just want to remind people some of the work that's been done in the state of California, the resources that we've made available to help support isolation. One of them, Dr. Ghaly alluded to, is these job-protected paid sick leave that we've now provided to California's workers, which is foundational in the endeavor of isolating and quarantine individuals. We've also targeted very specifically our farm workers and our agricultural workers all up and down the state of California, a program called Housing for Harvest. We had highlighted it on multiple occasions in the past in these updates, a program that now is operational, and we hope to do more and better still to expand the scale and scope of that effort. Project Room Key, which we've highlighted on a consistent basis, is foundational in terms of isolating individuals that are high risk of COVID-19, particularly those out on the streets and sidewalks, in congregate facilities and shelters all throughout the state of California. And of course, the federal government, no substitute gratitude for the support we get from the federal government. $150 million of federal support is provided, not just to the state, but also supporting those county efforts. In addition to those county efforts and federal dollars, it's that leverage of philanthropic support. Reference a moment ago what Kaiser has provided, other philanthropic supports, but some $83 million in philanthropic funds have been generated and recognizably, deservingly need to be highlighted in the effort to, again, support our isolations and quarantine efforts. So that's just a brief update on some of the contact tracing work, some of the isolation, quarantine work, the testing. We continue to make progress. We will very shortly, in the next couple of weeks, we will be announcing an update on our partnership with PerkinElmer and the efforts to more than double the capacity of testing here in the state of California. Real progress is being made in that space, and we look forward to making that announcement very, very shortly. We are not going to slip backwards on testing. We are going to forge forward and be much more aggressive. We're not ashamed of testing people. We're not ashamed of identifying individuals that have been tested positive. But we must make that meaningful. Testing for testing's sake is not in and of itself significant, save the patient that can learn about their own health and health risk. From a community spread and a transmission perspective, we need to make sure we go further than that, and that's the contact tracing, that's the education, Know Your Rights campaign, among many other efforts that we've advanced through PSAs that will allow people the support so they can isolate, they can quarantine, not only taking care of themselves for their own recovery, but mitigating the spread to people they love, and more broadly, the community spread. And so all of those efforts are being accelerated. All those efforts are being reinforced. And again, news very shortly on the very exciting and significant increase in lower cost, much more timely testing that we have advanced in this historic partnership here in the state of California. Let's talk about our case rates here in the state. The new number we announced today, 3,449 cases. This is from October 11th, yesterday. Tracks slightly higher than our 7-day average of 3,321 cases. You can see the positivity rate based on the 127,000 average daily tests over the last 7 days. It's dropped to 2.6%. That's a 14-day positivity rate. The 7-day positivity rate is consistent with the 14-day positivity rate, 2.6% here in our state. Hospitalizations have decreased 8% over a 2-week period, and we're seeing a decrease in ICU admissions, a little bit more substantial, 13% over 14 days. You may recall we're seeing a bit of a plateauing, or at least a slowdown in the rate of decrease. You've seen 20+% rates of decrease in hospitalizations and ICUs over the course of many, many weeks. It's slowing down modestly. Again, these are just areas of caution, sober reminder of how stubborn this disease is and how prevalent and widespread this disease still remains here in the state of California. Always a reminder of the imperative and importance we place upon practicing the physical distancing, social distancing, and the critical work that you can do by wearing these face masks. Accordingly, we have made progress on our tiered status. Now 42 counties of the 58 have moved out of that lower tier, the most restrictive tier, the purple tier. 24 counties you see in the red, 11 in orange, yellow counties in the northern part of the state, primarily, though some in the central part of the state represent 7 of our 58 counties. This county update, the tiered status update, is made every Tuesday. Dr. Ghaly will be updating these numbers. Progress, I want always to lean in, but they're always adjusting those numbers from the weekend, and so I have to be careful. But we will make progress. A number of counties now moving into new tiers, but again, stubborn, this virus, some counties teetering, and so that will be made public tomorrow. Some of the latest information, again, being put together later this afternoon, updated every Tuesday in Dr. Ghaly's presentation. But county tiered status, nonetheless, moving in the right direction broadly for the overwhelming majority, now 42 counties, out of that purple status into these other tiered status.